webinar on the future of clinical education, AI, simulation, and digital skills currency, empowering healthcare professionals with Proficien. I'm delighted to have you all join this session where we'll be exploring how technology, particularly AI, simulation, and digital credentialing, is redefining how we train, assess, and empower healthcare professionals. My name is Trisha, and I'm the webinar specialist at Proficien. And today at Proficien, we're transforming clinical learning and professional development through data-driven and technology-enhanced solutions. Before we begin our webinar, a quick reminder to please stay on mute, and this session is being recorded. Drop any of your questions in the chat or the QR box, and we'll be happy to address them towards the end of our webinar. And now let's move on to a quick introduction and objectives. So today, to understand the learning and development trends, to explore the and practical solutions and strategies in clinical education and training, and finally, to introduce Proficien's tools and services which can support healthcare professionals and institutions in clinical upskilling. Well, now here is a short pre-webinar poll on clinical education's future. We would like you to fill this out, please. And this is a quick poll that would help us to just assess your current knowledge about clinical education. And the poll particularly asks you two questions, and it speaks to you about your experience with clinical education, and your feedback in this poll would help us tailor our future sessions and ensure that there is maximum engagement. And so I will give you probably 2 minutes to just scan the QR code on your screens, and please fill out the survey. Thank you. All right, so with that, let's move on to looking at the learning and development trends. So the major learning and development trends which are shaping the education landscape today, which we can see are many of them, but these are in no sense exhaustive. So these are just a couple of majorly seen trends, both within the healthcare and across other industries. So the first trend, data-driven learning. Today, the institutions are using analytics not just to track attendance or completion rates, but to also map the competencies, the skill gaps, and performance outcomes. Data is no longer passive. It's becoming and transforming towards predictive nature. The second trend is upskilling and reskilling. Here, as the healthcare evolves, the professionals must constantly update their knowledge, whether it's the new technologies, the updated clinical guidelines, or emerging diseases. Learning agility has become as important as the clinical expertise itself. The third and fourth trends go hand in hand, learning on demand and contextual in-app guidance. Clinicians are increasingly preferring micro-learning and the modules which are quick, relevant, and embedded directly within their work environment. This is what we call just-in-time learning, which means accessible exactly when it's needed. The fifth trend here is the continuous learning culture. This means that instead of occasional training days, the healthcare systems are moving, or they prefer to have, to embed the continuous learning ecosystem, which is supported by good technology. And finally, two of the most transformative shifts, the video-based learning and the Gen AI video. These remain the most preferred mode of clinical learning. They are visual, repeatable, and easy to scale. But with the rise of AI, we are entering a new era of personalized, adaptive, and customized education. These all trends together here discussed, they all are laying the groundwork for a future which is dynamic, informed using data, and centered to the learner's needs and pace. Now that we've discussed some of these learning and development trends, let's speak about the innovations in clinical training. So shifting focus to how these learning and development trends are being specifically applied in clinical training, first we have the digital clinical skills currency. This concept here is about recognizing, validating, and updating clinical competencies in a way that is measurable and portable. Think of it as if your skill credentials update dynamically and reflect your most current level of clinical proficiency. This ensures that healthcare professionals remain digitally fluent, where both the clinical and digital skills evolve together. It also helps the employers identify skill strengths and training needs that have to be assessed and adapted accordingly. Second, the virtual and augmented reality, which is called the VR or the AR. The simulation is redefining hands-on learning. There are immersive environments which are allowing professionals to practice rare and complex procedures without patient risk. It also develops the muscle memory and decision-making confidence. With VR, we can replicate real-world exposure from emergency response to operating room procedures, and also use data to evaluate the accuracy and the readiness. Next, the AI-powered learning systems. Here, artificial intelligence enables personalized learning paths. It can adapt content to the learner's strength and also assess the gaps and predict the future skill deficiencies. So if there's a gap in your skills, then the AI would proactively figure it out and help you tailor your learning journey towards filling in the gaps. Imagine that this AI system recognizes your performance pattern and automatically recommends specific modules or simulations to strengthen the areas which need more work. The fourth innovation is the data analytics dashboards. Here, data analytics dashboards track your skill performance, the completion rates, and compliance readiness. They help the educators and the institutions visualize the competency growth in real time. And finally, we can't overlook the asynchronous and the synchronous models. These are hybrid frameworks that combine the flexibility with interaction. Professionals can anytime engage with, let's say, like workshops or discussions. They can also complete their work in real time, or they can keep it for later and complete it as per their flexibility and however the schedule allows. Together, all of these innovations, from asynchronous modules to data analytics dashboard, the VR and the AR systems, and most importantly, the digital skills currency, all of these innovations, they form a powerful ecosystem that can make learning in the clinical space more measurable, accessible, and deeply personalized. With this, let's see what Proficien is contributing. Here, our ecosystem includes the Proficien platform, which is for structured learning, the competency mapping, and skill tracking. So the Proficien platform is an app itself. We'll talk more about it in the coming slides. Secondly, the clinical governance consulting. So we help institutions design robust training and assessment frameworks. and it can be both on an individual level or a team level. The software development, we help the institutions and our clients design and customize education or compliance tools in the space of clinical space. And finally, the data analytics. We transform the data into accessible, actionable performance insights, and data analytics is the framework and the building block of our services. Now let's take a quick look at the features of the Proficien platform. At the core of Proficien's platform, we have three features. Number one, the skills tracking, continuous medical education, and educational activities. These are tailored to both individual and team levels. What truly sets us apart is our focus on the digital skills currency. The Proficien platform, which is an app, helps you maintain this currency by tracking proficiency, updating your learning paths, and linking outcomes to digital credentials and CPD hours. With Proficien platform, you can track and validate individual skill competencies, and engage in targeted microlearning, and align your professional development with CPD standards. Moving on to the Proficien system. So here we have stages starting from the needs assessment to intervention to evaluation. So we begin with an initial consultation where we understand your organizational objectives and the workforce gaps. We assess your problem. Then we move on to the proposal stage where we design a customized competency framework and a tailored solution which align with your goals and your needs. Next, we have the assessment where we evaluate baseline skills and training needs to have interventions. So the intervention can be in form of our Proficien platform, our app itself. Or we might also do consulting services, or it can be a software development where we customize a tool or an app to address your needs. And lastly, the evaluation and reassessment. We measure the impact, we track your progress, and we look forward to continuously improving the intervention and making sure that this cyclic model ensures the improvement in your clinical functions is not just temporary, but it is also a form of continuous learning culture within the organization. Let's move on to our Proficien app. So our Proficien app is available across Google Play and the App Store. So we encourage you to download our Proficien app using the QR code here. Please scan the QR code to access our Proficien app. Alternately, you can visit us on our website, www.proficien.com. And we invite you to connect with us to explore how our platform and our services can support you or your institution in your clinical training needs. With this, I will move on and open the floor to any questions. We are happy to receive your questions. Please type them in the chat box and we'll answer them towards the end. We also highly encourage you to connect with us on our website, and we welcome any questions related to the webinar itself or our app and our platform. We look forward to connecting with you. So with no questions at the moment, I would like to request you all to fill this post-webinar poll. Please take a minute or two to scan this QR code and go through the poll. It is a short poll and it would help us understand your feedback on this webinar session and also improve our upcoming sessions. We highly encourage your responses and we look forward to growing together. And with that, I will give you 2 to 5 minutes to just scan the QR code. Once we're done, we'll move on to wrap up. Thank you so much for your responses. And now I would like to move on to this slide where we have our socials. Follow us on social media and stay updated with our platform developments, our new features on our app, and upcoming webinars, of course. You can catch us on Instagram, LinkedIn, YouTube, Twitter, and of course, please engage with us, and we highly welcome your engagement, comments, questions, and we look forward to having you join us in our journey. Give you a moment to scan the QR code so that you could check us out on our social media platforms. Now, here's something exciting. Proficien is running a promotion where the first 100 users who sign up using this QR code here on your screens will receive a free trial of Proficien's new features. So our app on Proficien has launched new features, and we invite you to scan this QR code so that you can be a part of the first 100 users to experience these features. Spots are limited, so if you are curious about technology transforming your clinical training workflows, this is the perfect opportunity to explore all of this. I'll give you a minute to scan the QR code here. And the spots are filling up fast, so we encourage you to go in and give us your details for the contact, and we'll be in touch with you soon. And with that, thank you so much for joining us today. We highly look forward to seeing you at our upcoming webinars. Thank you very much for your time. Much appreciate that you were able to join us for this session. And please do follow us on our social media platforms here. We have quite active community, and stay up to date with all our events, webinars, and all the updates. Thank you very much for joining our webinar, and stay well and keep in touch. Thank you.